Can everyone hear me okay? Awesome. I think I have a hungry group, so that'll be interesting. So my name's Katie, like Natalie said, and today I'm going to talk about the health opportunities that exist in the built environment. But to start, I wanted to introduce everyone to a couple of people. So this is Deb. Deb talked to me about how older adults in the Calgary area are faring as they get around the city. She says she knows many people who have spent their lives relying on cars and driving at a complete loss for how to stay connected to their communities when they can't drive anymore. So isolated older adults are at an increased risk of depression, anxiety, developing dementia. And this is a group of Canadians that contributes over 1 billion hours of volunteer work each year. So this is a loss, not just for themselves, but for the communities that they live in as well. And this is Cal. Cal is a diversity and accessibility consultant in Calgary. He spoke to me about his experience using a wheelchair to get around our city. He told me a story about having to call emergency services one day when his wheelchair got stuck in a snowbank because the city hadn't cleared the snow around his house. Calgary currently clears only 4% of the city sidewalks. That's compared to Ottawa's 90%, which is a pretty huge difference. And for the island folks in the room, Calgary has about 95 days in January, so this is a pretty important topic. And this is me, looking cool in my hiking gear. After moving back to Calgary from living in Victoria for 9 years, I tried to walk home from work one day, thinking I walk in Victoria all the time, not a problem, why can't I do that here? But the sidewalk ran out about 20 feet into my walk, and I looked at the bus stop, wasn't going to be there for another 45 minutes. So I found myself teetering on the edge of a super busy road, 70 kilometers per hour, feeling like my life was very much in danger. Eventually I met a dead end at a chain link fence. So I just admitted defeat, very ungracefully crawled over that fence and waited for a ride from my dad. So through these stories, we can see how the built environment, the roads, buildings, sidewalks, bike lanes around us can impact the choices that we make and ultimately our well-being. So we can see that the built environment really impacts our health. So people in pedestrian-friendly areas are less likely to be injured. And active transportation, so I'm sure most of us know, is a human-powered transport, walking, biking, rolling, dancing, that's for you, Trevor. And when it is an option, people will choose it. And this choice helps prevent development of non-communicable diseases. With more people using their cars less, air pollution will decrease, making breathing easier for people with respiratory and cardiac conditions. So one of the people that I talked to said that active transportation gave them a magical feeling. And there's research to back this up, not out of Hogwarts, but all over the place. Active transportation has a big impact on your mental health, your community connectedness. So this isn't only a health issue, but we know health is very complicated. This is part of health. It's a social equity issue. So as it stands, many of our cities and the places in them are built for cars, not for people. So take, for example, this dog park by my house. This lovely fence hole gives access to a green space, walk to the train filled with puppies. It's great. But the city has repeatedly filled this hole. Every time they do, a community member brings out their trusty wire cutters. So we have mountains of research on the dangers of sedentary behavior and busy roads polluting our air. It's good to encourage people to be physically active, but when they have to take part in guerrilla urbanism to access safe spaces to do so, then it's a little bit pointless. As you can probably tell, I'm really passionate about health, equity, our planet, and that led to my practicum at Sustainable Calgary. Sustainable Calgary was founded when a group of Calgarians saw that we're measuring progress by economics rather than social networks, ecology, and cultural life. So I worked on the Active Neighbourhoods Canada project. oh, I'm so worried about time right now, which is a pan-Canadian partnership between Ontario, Alberta, and Quebec, funded by the Public Health Agency of Canada. And they aim to create livable, vibrant communities with active transportation options using a participatory planning approach with community members, urban planners, and government decision makers. Time is up. Oh my goodness. Oh no. Oh dear, I did this so many times. I'm going to rush through this. My work with Active Neighbourhoods contributed to the policy development plan. So mine, what I did was telling personal stories, like the ones that I told at the beginning here. So basically, if we started prioritizing people over the cars that they wear. And the point of telling these stories to stakeholders was that right now we're permitting our cities to be built like this. And if we want to inherently encourage people to be more physically active, we need to build places that look like this, but we need to make some big changes to do that. So we currently have ministries of health recommending active transportation, but it is a ministry of transportation that would be building and funding the bike lanes, sidewalks, and transit lanes required to do so. So these stories are used to influence buy-in, encourage interdepartmental communication and policy and budget change at all government levels. Yes, sorry. That is done. I will skip the rest. Just wanted to say thank you to Celia Lee, my amazing practicum supervisor, who let me get really creative with policy development solutions, which I thought was awesome. All the people who contributed their stories to me, and the amazing professors, Betty, Natalie, Victoria, Lillian, you guys just inspired me so much, and all the rest of the PHSP staff. Sorry for going over. Thank you very much.
Thank you, Katie. Clearly you need to do an MPH so you get 10 minutes up there. Oh, yeah. Well, hopefully someone will ask a question that'll let you tell a little bit more of what you did. Sure. So, anyone have a question, please, for Katie?
Oh. Thank you.
Can you tell me what was on the part that you skipped over?
I appreciate that. I will read that part off. So part of what I wanted to do with these stories was to communicate in a different way with people who got to make these decisions. So often it's facts, it's numbers, and people who make those decisions are people. So I think we really need to put a personal face to the impact that these policies are having on people. So they demonstrate that the value created by changing how we build our cities isn't just done by spending more, it's done by spending differently. So it's advocating for a Band-Aid solution. So rather than just a sign that says share the road, or those kind of pedestrian shaming advertisements that tell you to lock eyes with a driver, we're changing the built environment to keep people safe, healthy, and connected. That was it. Thanks.
Thank you, Katie.